en las heces, sin querer decir que esto es sangre que podamos ver. Es decir, esto es la importancia. Nuevamente estuvimos hablando en varios programas atrás de la importancia de la relación con el médico, de tener exámenes médicos anuales donde se hacen exámenes de sangre, donde se hace examen de las heces para ver si hay sangre oculta. Eso no quiere decir, el hecho que tengamos sangre en las heces no quiere decir que la vamos a ver inmediatamente.
Exactamente, no es que usted va a ver ahí la sangre roja tal y como es. Usted puede estar escondiéndose dentro de sus desechos fecales. También menciona el doctor Lomboy sobre la anemia.
Que siempre que haya una anemia se tiene que explicar, porque cuando se encuentra sangre en las heces hay que explicarlo, porque es por una causa benigna o por una causa maligna, es una cosa que está, pero definitivamente no es normal que exista.
Y algo muy importante, entre los síntomas, puede que en algunos casos no haya ninguno de estos síntomas que hemos mencionado.
Y una de las cosas que nos debe dar un respiro, pero eso no quiere decir que tenemos que bajar la guardia, es que nosotros los latinos no estamos a mayor riesgo de padecer del cáncer.
No es que estamos exentos.
No estamos exentos, sino que a diferencia de, por ejemplo, nuestros hermanos afroamericanos, que tienen un 25%, creo que es what was the higher risk for African Americans? I'm sorry.
20 to 25%.
20 to 25%. Nuestros amigos afroamericanos de 20 a 25% a mayor riesgo de padecerlo. El hecho que nosotros no tengamos mayor riesgo no quiere decir que no tengamos riesgo.
Según la American Cancer Society y la data que ellos tienen, es alrededor de 10,000 latinos o hispanos son diagnosticados cada año, alrededor de 3,000 mueren anualmente. Son datos de la American Cancer Society que nos trae el doctor.
Son números bastante interesantes. Then, Doctor, we talked about the colonoscopy being both a diagnostic and possible treatment. Does this mean that, yes, every colon cancer case can be treated with during the colonoscopy, or are there other types of treatment that the person might be?
Yeah, the ideal thing is that if we find a polyp, sometimes these polyps can contain cancer within themselves, and they can be removed completely. So in that situation, yes, the colon cancer is treated with a polypectomy, removing the polyp. But if the growth or the cancer is too large and it cannot be removed during the procedure, then we're talking surgery. The person will need an operation to remove it. And depending on what's found at the time of the operation in the pathology specimen will determine whether or not that patient will require additional treatment.
Now, is colon cancer also, like many other cancers, divided in different stages?
That's correct.
Correct. What are the stages?
Well, the earliest stage is stage 1, and the worst is stage 4. Stage 4 means that the colon cancer has spread beyond the confines of the colon. It can spread to the lung and to the liver. Those are the most common locations. And so this is why it's very important to screen for this disease. And in fact, up to 25% of colon cancers are picked up with just screening. In other words, patients who have no symptoms, they come to see us because they're 50 or whatever, and up to 25% in men and 15% in women are picked up with the initial colonoscopy. So we concentrated about bleeding and pain, but there's also no symptoms, that could present with colon cancer. And so the message here is the earlier detected, the better the outcome.
The better the outcome.
That's right.
And we want to concentrate on outcome.
That's right.
And we want to concentrate on prolonging life and quality of life.
That's correct.
And
yes.
it is a matter of us, you can't make the house calls with your colonoscope and say, hey, I hear you're turning 50. We need to know that we have to come over and,
right.
and ask for the test for us to get it.
Mm-hmm.
Now, prevention. Is there a way in which we can raise our children and reduce that 5% risk? Is there something that we can do from the moment we start putting food in our mouth to prevent colon cancer in the future?
Well, besides our screening efforts for colon cancer, there are some reported factors that can potentially decrease the risk, but it does not still change the strategy of having a colonoscopy. But for example, physical activity, just being active alone can potentially reduce your risk up to 27%,
27.
as
Wow.
opposed to having a sedentary lifestyle. Food, dietary-wise, eating low red meat or animal fat content.
Oh, that's not going to help you.
Now, as far as fiber, we always emphasize fiber is good for you, but unfortunately, dietary fiber has not been shown to.
Oh, really?
Yes, that's surprising, except for certain vegetables like fiber from grains.
I thought you were going to say right away, a diet rich in fiber is going to help. It's just something that we think that it's automatically good for you.
Yeah, not all fiber, not all vegetables have a protective effect. The ones that are cruciferous, for example, broccoli, cabbage, lettuce, those types of vegetables have a greater effect. Fruits and vegetables, disappointingly, in general, have not been really shown. And there have been some big studies that have shown that. But I think it is
So
still
you
good
would
for-
say that exercise, active life, has a greater impact on reducing the risk
that and
than diet itself.
Well, no, I think that's not the message. I think
Oh.
these are all things that a person can do to lower the risk. I mean, I think they're all equally important. Other things, smoking and alcohol.
Oh, there we go, yes.
This is very good for your overall general health, but studies have also shown that smokers and people who drink anywhere from 2 to 4 drinks of alcohol a day are at increased risk for colon cancer.
So it's incredible that we're talking about the colon and you mentioned smoking. Increíble, Héctor,
Súper
que,
interesante, señora,
hablando sobre, no estamos hablando del cáncer del pulmón y el doctor Lomboy nos acaba de decir que una de las recomendaciones es dejar de fumar,
Dejar de fumar, y
no
estamos
fumar,
hablando del
para
cáncer del
reducir la incidencia de cáncer de colon, el ejercicio, la dieta balanceada, no
Que a ti no
comer
te gustó.
tantas carnes rojas
Ni
y grasas
grasas
animales, reduce la incidencia de cáncer de colon. Y a pesar de que dijo de que la fibra no se ha comprobado, no es que le está diciendo, no es que estoy diciendo que no ayuda, pero definitivamente no se ha comprobado que ayude tanto.
Que ayude
pero
tanto.
sí es importante, sobre todo los vegetales como el coliflor, el brócoli, la lechuga, tienen algún efecto
Y
positivo.
mantenerse activo. Nos llama un radio oyente y nos piden, si es posible, que el doctor hable del proceso, de cuando uno llega, cuál es el procedimiento, cuando sale uno de la sala, porque tengo entendido que es una sala de operación a la que uno llega para que se le realice la colonoscopía. Que nos hable del proceso para nosotros.
Aquí estamos. I'm sorry. Here I went to talk to you in Spanish also, but very important question. Somebody wants to know the process for the colonoscopy. What happens? How? Describe to us. I have an appointment. Let's say today at 9 o'clock with you. What do I need to do before? What happens when I get there? What happens after?
Well, usually what happens is once an appointment is made, it can either be a consultation initially, or if a person is healthy, we can just go ahead and make the appointment for the colonoscopy. Now, the colonoscopy involves a cleaning out process, okay? Patients will need to drink a medication that will clean out their colon or cleanse the colon. On the average, it's about 64 ounces of volume that they have to drink. And it's given in divided doses, one half the night before, the next half the following morning. And then once that's accomplished, they come into our center. It's an outpatient procedure, either in the hospital, and we have 2 outpatient facilities. And they come in.
Where are they? Where do you have?
One is at the health campus, and the other one is on Oregon Pike in Brownstown. And so once they come in, they meet the staff. They will get an intravenous placed. This is how the medication is given. The medication is given by a board-certified anesthesiologist or nurse anesthetist. And I want to emphasize the medicines are very safe. And once a person is sedated, the procedure is painless.
So the only process of the IV is sedation. There's nothing to dilate anything or it's sedation.
It's sedation and IV fluids, okay? And so that's how we administer the medications. People will be comfortably sleeping, and that's what is important because people fear this procedure because of pain. You know, it is purely a painless procedure, you know, during the actual procedure. And it takes on the average 15 to 20 minutes to do the procedure. At the completion of it, the patient wakes up, goes in recovery, and then I come out and talk to them, let them
Now,
know
the
what we
procedure
found.
itself is 15 minutes. How much time altogether between the time you arrive and then the recovery time? What's the average amount of time that you would be at the doctor's office?
We have our patients usually show up anywhere from half an hour to 45 minutes before, and then given 15 to 20 minutes for the procedure, and recovery on the average about half an hour.
Half an hour.
afterwards.
So it's relatively short. So
Yeah.
after that, you can go back to work?
Well,
Or is it going to be?
It depends. You know, we advise, because technically they're under the influence, they receive medication. We advise our patients not to operate any heavy machinery or make important decisions until the following day, at least 24 hours after.
Especially that part of making important decisions.
Making important decisions,
It's
yes.
not the time to go sign a lease or to go
And-
sign your
yeah,
will.
and we don't-
Or change your insurance policy.
Yeah, they have to be brought home by a family or relative because
Okay.
we don't want them to drive home.
Okay. So, el procedimiento básicamente desde el día anterior, you said about 60 fluid ounces?
64 ounces.
64 ounces.
That's correct.
60, son 64 onzas de una sustancia
sí.
que limpia
Para
el colon,
limpiar
para
el colon.
limpiar el colon, y usualmente se divide en dos partes, una la noche anterior y otra la mañana del examen. Una vez que se ha limpiado por completo el colon, el paciente usualmente va al médico una media hora, 45 minutos antes. Se le administra un sedante por vía endovenosa. Esto es una de las partes, son medicamentos que el doctor Clifford Lomboy nos habla que son completamente seguros, donde la persona simplemente se va a sedar para asegurar que este sea un procedimiento completamente ausente de dolor. Y el procedimiento dura aproximadamente 15 minutos, ¿verdad? Y usualmente, de acuerdo con el doctor Lomboy, se tarda una media hora a 45 minutos el proceso de la recuperación. Más sin embargo, no se recomienda que ese día la persona, el paciente, maneje,
opere ningún tipo de
maquinaria
maquinaria
pesada o tome decisiones importantes. Es decir, el día de su colonoscopía no es el mismo día para hacer una cita con su abogado para escribir su testamento o para cambiar su póliza de seguro o para hacer decisiones importantes. No es un día porque usted estará durante ese día bajo los efectos de un sedante, de un
anestésico. Señoras y señores, yo, José, personalmente me sometí a este procedimiento hace algunos años. Creo que lo mencioné la última vez que hablamos. Es un procedimiento muy seguro. Mi única preocupación era de que iba a roncar mucho cuando me dormiera. Era mi única preocupación.
Lo más seguro que lo hiciste, probablemente.
No sé, porque ya cuando me levanté estaba en una habitación de recuperación, junto, obviamente dividido por una cortina con otros pacientes que ya se habían sometido o estaban listos para ser sometidos a la colonoscopia. Es un proceso seguro, le da a uno luego una sensación de seguridad, y tranquilidad, gracias, de tranquilidad. Y me parece que si usted tiene alguna duda o si ya usted ha cumplido los 50 años o como mencionó el doctor, entre las personas que
tienen más riesgo.
Que tienen más riesgo, están en más alto riesgo, sométase a este procedimiento que es muy seguro y le va a dar una sensación de seguridad tremenda.
Hector is talking about his own experience. Even though he's not 50 yet, he had to go through.
I think he was the doctor that performed that. I think he was the one. Yeah.
Okay.
And that he is vouching for the safety, and not only that, the sense of peace that he had afterwards of just being able to say, you know what, I'm okay. There is something very, very important. So that after this procedure happens is when you said that you're either only going to need you will make that determination. I need you again here next year. I need you again here in 3 years, or you're fine. We'll see you in 10 years. Is when that happens.
That's correct, yeah.
At that point, any message, any particular message for our listeners, those who are listening today, of what is it that you see us consumers doing wrong? What is it that we are not doing that you would like us to change and say, please do this, start doing this?
Well, it's the reasons are unclear, but for some reason, less than 1 out of 3 Hispanics who should be screened are screened, as compared to 49% in the non-Hispanic population. So I think part of it is we need to get this information out. And again, thank you for having me in this program, because this is very important. But as I mentioned, if you're 50 and older, get it done. First, talk to your family physician. If you have friends, relatives who've had experiences with this, talk to them. But really, it's up to you to just say, this is what I'm going to do to improve my life and potentially save
So
my
let's
life.
just say that somebody who should be screened is listening to us today. Do they need to be referred to you, or can they just say, I'm going to Dr. Lomboy's office because I need to be screened?
They can call us directly.
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 You don't necessarily need to be referred by your family physician.
Not necessarily, okay? But if it's something that, you want to talk to somebody an issue, you can talk to your family physician, but you can call our office directly.
So what is the number?
The number is 544-3400, and that's with Regional Gastroenterology Associates of Lancaster.
544
3400.
3400. Bueno, damas y caballeros, una de las cosas, uno de los cambios importantes que el doctor nos está diciendo es que definitivamente entre nosotros los hispanos no le estamos haciendo caso a esta enfermedad. You're saying that only 1 out of 3 of Hispanics that should be screened.
That should be screened.
Solamente 1 de cada 3 hispanos que debería estarse haciendo la colonoscopía se la está haciendo. Quiere decir que sabemos que hay 2 personas de 3 que se lo deberían estar haciendo, que nos están escuchando en este momento, que no han tomado las riendas de su salud y decir que lo tienen que hacer.
Y nadie lo va a coger por la mano y lo va a llevar a la oficina.
Usted tiene que ir.
Usted tiene que ir, señora y señores. ¿Cuál es la dirección de la oficina de nuestro invitado de la mañana de hoy?
The address for, you said that there's one in the health center, the health campus?
Yes.
In Harrisburg,